the stringent regulatory authority of reference, but the product was already approved also by the US FDA. The expected timeline that we were looking for in this situation was the following. So we didn't have the candidate product selection stage because, as mentioned, this procedure the participants and arrays to this procedure are the Philippines, which are acting as lead national regulatory authority for the procedure, Malaysia, Myanmar, Vietnam, and Thailand. And I would like to highlight that Thailand joined the procedure at a later stage compared to the other countries. What I'm going to do today, so I will walk you through the key steps of the process and the associated timelines. I made a comparison of the expected timeline according to guideline versus what we are expected in the reality. And I will also highlight what we believe are the benefits and the challenges of this process. Next slide, please. So starting at the end of 2021, after a very successful collaboration with the WHO team using the CRP process in the African markets, the WHO invited VIV to submit an application for an innovative product using the Asian joint assessment process. So between the end of 2021 and the first half of 2022, VIV submitted the expression of interest to the WHO to participate in this, let's say, reviewed and improved process. So for us, it was a kind of new pilot. And as I mentioned, we used the TGA Australia as reference stringent regulatory authority. During the first half of 2022, we have also completed the confidential agreement with the WHO. We finalized the preparation of the technical documentation, module 2 to 5. And I would like to highlight here that the preparation of the technical documentation was done in parallel to the SRA evaluation. So before the approval from Australia was granted. And this was agreed with the WHO in order to maximize any stringent regulatory authority feedback and the resources to support the joint assessment. And I would say that this really emphasizes how much focus is there to make sure that patients get access to those medicines in a timely manner. So it was really appreciated. A great level of flexibility was shown in this respect. So going back to our flow and our procedure, it took us around 6 months to prepare all the pre-submission activities. But again, I didn't give a proper estimate because we didn't go through the standard candidate product selection. So it's probably atypical if you want to benchmark what we have done in this situation. Between June and September 2022, we finalized the submission of the dossier. So starting from the submission of the technical part, module 2 to 5, we have been utilizing the James portal. And at the time, we believed that the submission of the technical dossier would have triggered the assessment of the product. Actually, it wasn't exactly like that. In parallel, we continue to work with the WHO to submit module 1 and all the administrative documentation. And we soon realized that the assessment of the procedure would have been initiated only after the submission of module 1s in each participating country and after the validation of the administrative part. So I mean, at some point during the procedure, the day 0 was retrospectively assigned, but it was a bit of a roller coaster to get to that point. And I think it represented a big learning for the company, but I will share the learnings at the end of the the slides. Um, Also, some of the national regulatory agencies requested full submission of Module 2 to 5 to the national portals. So despite the fact that everything was submitted into James portal, we had to replicate the submission locally from Module 2 to 5. And also, I wanted to highlight that the Thai FDA expressed their interest to join the Asian Joint Assessment basically 1 week after we filed the national marketing authorization application in Thailand, which was a great news. And Thailand is now part of the overall WHO facilitated process. Next slide, please. So in December 2022, we received a list of questions. That list of questions included comments from the Philippines, Malaysia, and Myanmar. Thailand submitted a parallel list of questions, including validation questions at the same time. So in terms of calendar, it was following the same pace. We didn't receive comments from Vietnam at the time, but we have received a list of questions after we've submitted the responses to the joint assessment list of questions. In May 2023, we have finally got the favorable opinion from the joint assessment review, despite having some late questions. And it was a conditional favorable opinion based on the fact that some questions were still pending because received later in the process. So great news. The assessment report was shared. We entered the national phase, which is still ongoing. So on paper, the national phase should take between 1 and 3 months. I'm going to give you a bit of an update of where we are with the 5 countries participating to our process. So we have got approval in the Philippines the 3rd of August, which is a great news, of course. And this approval was granted also including 1 round of administrative questions during the national phase. So the process was overall efficient. In Malaysia, the approval is expected soon. We have got administrative questions. We have responded to those questions and we are waiting for final feedback. The approval is also expected in Myanmar. No questions have been received during the national phase. For what concerns Vietnam, we have received additional questions. The company is supporting those questions. We are preparing the responses. We are in contact with the agencies. However, we have been anticipated that there will be additional technical questions by the end of the year. In Thailand, additional questions are still expected in September, but this was kind of expected because the country joined the assessment later in the procedure, and we were expecting some additional technical questions. Next slide, please. So this is I won't spend a lot of time here. This is just a visual representation of the timeline for our product. And the aim of this slide was to show that initially in the procedure, we have been able to work in parallel on few aspects of the dossier preparation. Meanwhile, the stringent regulatory authority was reviewing the dossier. Confidential agreement, CPP preparation, that there was a great level of flexibility allowing to waiver the CPP submission after the approval in Australia would have been received. So when we submitted the technical dossier in June 2022, the CPP was not yet available, but the open dialogue with the WHO and TGA and the NRAs, of course, allowed to get to this agreement and have a waiver for the CPP. And then the national phase that is still pending, as you can see, for 4 out of the 5 countries. Next slide, please. Okay, this is the comparison I made and I prepared on the expected timeline versus the actual timeline. So as you can see, and as you know, there are two stages. Stage one, the joint assessment, where the technical review is happening, relying on the assessment reports that TGA Australia, in our case, shared with the NRAs, and also based on the lead NRA, the Philippines, that have been coordinating the efforts and making sure that a kind of mutual recognition process was in place. After I mean, we had few challenges on getting to time zero, day zero, for few reasons that I will explain later. But after that, the stage one of the procedure went fairly smoothly. As you know, the expectations are to deliver a joint assessment report in 150 days, excluding the clock stop. And in our case, we have got to the joint assessment report in 190 days, which is a fair outcome. The national phase, which is still ongoing and for which we are expecting, I mean, we were expecting only administrative questions, as you can see, was completed in the Philippines in 70 days. For what concerns Malaysia and Myanmar, we are fairly confident that the process could be completed in 90 days plus or so. And this is based on the interactions we are currently having with those countries, with those health authorities. For Vietnam and Thailand, it's a bit difficult for us to make a prediction, but based on the fact that we are still getting technical questions, we can project the completion of the national phase probably in 180 days plus. So it's still an ongoing process. Next slide, please. Yeah, so the benefits. Of course, this process has a huge potential to significantly improve the review timelines from 24 plus months via a national application to 7-8 months using the joint assessment process. When successfully executed, there are major benefits in terms of regulatory resource burden that can be reduced both from the applicant side, but also the assessor side. I would like to flag, and this is really a personal comment, the great collaboration and engagement from the WHO team and TGA Australia in this case. So we always had a very open and transparent dialogue. We felt supported throughout the process, that there was the aim to really facilitate and make sure that the assessment was carried out in a successful way. So big call out to the collaboration we had for this procedure. The stringent regulatory authority has been always very committed to the procedure. We have got feedback in a very timely manner. Everything was really quick. Everything was really supported. So I think that there's a good potential to get this procedure working as per the guideline as it should be. Next slide, please. Now, limitations and challenges. So as I mentioned on the timelines, the procedure calendar and the review start, so the T0 was a bit unclear. So we struggled a bit at the beginning of the process. The key learning for us is to provide module 1 at the same time of sharing module 2 and 5, because despite the fact we thought it was enough to share module 2 to 5 to trigger the assessment, the reality was that validation of module 1 was necessary in each country before starting. So this is a key learning point for us. Some delays were also faced because of misunderstandings also from our side related to module 1 and local legal requirements. So it took a bit more than what expected. And I'm sure that in the next procedure, this would go very smoothly because it was a massive learning curve also for us. And overall, the stage one of the procedure almost adhere to the expected timeline, although the national phase in some instances is still largely exceeding the expected timeline. One suggestion from our side here, so after the module one are fully validated, I think it would be great to have a procedure calendar with actual dates, triggering the day zero, the T0, and making sure that a calendar until the end of the procedure it's shared between WHO, NRAs, SRA, and the applicant, because this would allow to really allocate resources and making sure that everyone is committed to deliver what expected in a timely manner. And I can make an analogy like we have in when we work at kind of mutual recognition procedures in Europe. The timetable, the calendar, it's very clear, and I think it helps to make sure that everyone respects the flow of the process and there are no delays. When it comes to reliance and dossier content, another key aspect, I think it's really important to make sure that the reliance concept is embraced, and it's a key principle of this procedure, which means that the technical assessment should be completing during stage one, relying on the assessment reports already prepared and shared by the stringent regulatory authority, which is the spirit of a procedure like this, and also leveraging the lead NRA coordination, leaving then only administrative questions for stage two. Another suggestion from our side is to make sure that there's a kind of harmonization of module one across the countries. Of course, we are really aware that there are local legal restrictions, and it's not an easy process to harmonize everything, but it's an effort that in the long term would be really beneficial for the region. Then when it comes to IT, of course, the James portal, it's something that has been offered by the WHO that was very supportive of the usage of the platform, and we use the platform. But when we did a reality check, we realized that the NRAs didn't fully utilize the system, so we had to resubmit nationally. And ideally, it would be great to have one platform that can be used by the applicant, the NRAs, and the WHO, and one platform that would bring everyone on the same page. In the interim time, I think it would be great to have more clarity in terms of expectations, so that the company can provide the right documentation and the right packages at the right time. And then last but not least, the post-approval. So we are all aware that at the moment there's no post-approval changes management guidance. And I would have expected something similar to the CRP processes, where a guideline for the management of post-approval changes is available. So we are looking for something in that area. And yeah, I think this is my overall summary of highlights. And I would like to thank the WHO, the stringent regulatory authorities, and the NRAs for the support throughout the process, because there's a key willingness to make it work. And I hope, it was clear that the same intention is from our side. So despite the learning curves, we are trying to make it work and to deliver access to market to the patients that can benefit from our products in really a good time. So thank you very much.
Thank you so much, Julia, for a very comprehensive and detailed presentation, providing some good lessons learned and from this ASEAN Joint Assessment Procedure for cabotegravir. I just would like to mention that this was indeed a pilot for the company, but it was also a sort of pilot for ASEAN joint assessment procedure in the countries, because the procedure has just been revised before this product submission. So it was also the first time for countries to apply this new revised procedure. So indeed, there were a lot of lessons learned, but as Julia mentioned, there was also significant benefits experienced by reducing the assessment time from 24 months in many NRAs to 6, 7, 8 months as a VWelfcare experience. So thank you so much for sharing also these positive learnings and experience. We will also be discussing some areas for improvement and the lessons learned at the end of this session. In the meantime, I would like to ask you, Julie, if you could stay in line. We will be having a Q&A session after the next presentations. And I would like to call Sabrina from Roche, Sabrina Su, who will be making a presentation on some experience with ASEAN joint assessment and ongoing procedures. Thank you so much, Sabrina. So the floor is yours.
Thank you, Dr. Mariana. Hi, good afternoon. I'm Sabrina from Roche. I'm very grateful for WHO for inviting Roche to present on our experience with the ASEAN Joint Assessment Procedure. Next slide, please. So before I start, just a disclaimer that the presentation that I'll be sharing today is based on my experience with the ASEAN Joint Assessment Procedure. Next slide, please. I'll be breaking down my presentation to 3 parts. Firstly, I will go through the reasons why Roche decided to select the ASEAN Joint Assessment Procedure for our molecule. Secondly, then we'll go through the benefits and advantages that we have experienced with the use of the ASEAN Joint Assessment Procedure. And lastly, recommendations on further improvements of the procedure. Next slide, please. Roche submitted our application using the responsive application route, and we used the expedited JA procedure. We have 6 participating NRAs with Malaysia as the lead, and this was summarized as well in Dr. Azwana's slide. Our application is still ongoing review at the moment. Now, briefly on why Roche decided to select the ASEAN Joint Assessment Procedure. Like Viv, this was a pilot for Roche. It's our first time using the AJA procedure. And what we found was the evolution of the procedure and subsequent issuance of a revised procedure early of last year enabled us to identify a molecule that met the eligibility criteria to submit under AJA. And 2 key changes made to the procedure was what enabled us to identify this molecule. Firstly was expansion of the priority list and expansion of the product categories to include biologics. Roche also believes that this procedure has a lot of benefits to patients by enabling faster access of medicines to patients through faster registration approvals. And the 4 enablers to this, firstly, is the opportunity to coordinate and also achieve approval across multiple countries collectively. And secondly is the addition of an expedited registration pathway with shorter review timelines compared to the original full evaluation pathway. Thirdly, the introduction of the James IT infrastructure, which improved efficiency significantly. And also, through convergence, there was the opportunity to reduce country-specific requirements. Next slide, please. Now, moving on to the benefits that we've experienced so far with the AJA procedure. The first one being having a consolidated list of questions received via AJA avoids duplication of questions versus if we were to submit this application individually to each NRA, we would have received possibly duplicate questions and many more questions. And through this, we realized that the value of the joint assessment can be realized. And secondly, the expedited JA pathway is faster compared to the full evaluation pathway. And like Dr. Mariana shared, the concept of recognition is applied when it comes to the expedited JA pathway. And through conversions and collaboration amongst the participating NRAs, there's that possibility to reduce country-specific requirements as countries learn how the requirements are in each country. And lastly, this is an entire internal benefit whereby there is a need for just one central coordinator to liaise with WHO, to upload documents into the James platform, to download the list of questions, to coordinate internally to get the responses to questions and then feed that back into the James system. So that does help with improving efficiency internally. Now moving on to the recommendations. So I have 7 slides on the recommendations for further improvements. The first one being timelines, and this was touched on several times and also mentioned by Dr. Azwana as well in her presentation. The timelines that we experience is longer than the expected timeline stated in the AJA guidelines. And in this table here, I've called out 3 specific steps where we've observed that the timelines were significantly longer than what's stated in the AJA guidelines. The calculation over here starts from the time of expression of interest submission, not for the time of assessment. So the first step here is where the lead NRA seeks concurrence of the participating NRAs whether to accept the EOI or not. According to the AJA guidelines, this should take 30 days, but in our experience, it took 72 days. And the time for the assessment to start, according to the AJA guidelines, should take 105 days once the EOI has been submitted, but it took 169 days in our experience. And the timeline for the NRA to share the list of questions with us took 279 days compared to 195 days stated in the guidelines. Next slide, please. The other recommendation is related to the workshop that WHO, the advocacy workshop that WHO is holding, like the one that's done now. So what we observed was after the revised guidelines was issued early of last year, in our engagement with NRAs, we realized that NRAs were not too sure about the changes that were made to the procedure, and there was a lot of uncertainty about the process. But subsequently, after the Bangkok workshop that was done by WHO in September of last year, and following further engagements with the NRAs, we realized that workshop really helped. NRAs had a clearer understanding of the guidelines, and there was also buy-in from the NRAs. So we would say WHO should continue doing this every year, and it's good that we're having this right now, and also open up this workshop to maybe more members of ASEAN NRAs so that the knowledge is not just held within a few individuals in the NRA organizations, but shared with many more NRAs. Next slide, please. This recommendation is talking about the difference in timeline for submission of the local registration dossier compared to the AJA submission. So what we found is that some NRAs required the full set of module 1 to 5 to be submitted in the national registration system at the same time that the AJA dossier was submitted. And there were also some NRAs that said, don't submit all into the national registration system, just give us the module 1 for our country. Wait until the AJA review is completed, and then you submit the final set of documents into the local registration system. So there's that difference in expectations. And what we would recommend is for individual NRAs to only require the module 1 documents to be submitted in parallel with the module 2 to 5 that are submitted in the AJA system, the James system. The reason for this is because when we receive list of questions, in our response, there's a chance that some of the documents in the modules 2 to 5 will be replaced. And that means there's a need to duplicate the effort to replace the document in response to the AJA queries and also in the national registration systems. And what we don't want is for documents to be misaligned. Next, please. So this recommendation is related to the list of questions. In our experience, we experience some individual NRAs sending us questions directly to our local company representative prior to the AJA list of questions being issued. And later on, when we did receive the list of AJA questions, we found that the questions were duplicated. So the same questions that was asked to our local representative were duplicated in the AJA list of questions. And that led to a little bit of confusion on our end about the procedure. Our recommendation is to stick to that one consolidated list of questions submitted to the company through James and not to the local representative. So that on our end, we can also consolidate the response and then upload it to submit it through James for the lead NRA to then distribute to the other participating NRAs. However, having said that, we still appreciate having an open communication and discussions between the applicant and also the NRAs, because there may be simple questions or simple clarifications that can be addressed through these discussions and do not need to be addressed formally through this LOQ. Next, please. The other recommendation is on country-specific information and licensing requirements. Currently, there is still a need to submit country-specific information such as CPP, stability data that diverges from international guidelines, and one example of this is site-specific stability data. Some countries also require analytical method SOPs and analytical method validation, and some countries do not allow multiple sites on one license. Our recommendation is to align with the ICH and WHO requirements, for example, when it comes to stability data. And country-specific information which are not scientifically justified or do not add value to the review of the product quality, safety, and efficacy should not be required. For example, the CPP can potentially be replaced by an approval letter. And where multiple sites are involved, the countries can also consider to harmonize the requirements to allow multiple sites in one license for all participating countries. Next, please. This recommendation is related to James. So I must say that I am very grateful for Dr. Valerio for being so helpful with all the questions that I had. He gave a one-on-one training. It seems that Dr. Valerio never sleeps. He works round the clock. So every time I have questions, help Dr. Valerio, he will reply immediately. And I really appreciate that. But my question to WHO would be, what are the plans for James? Is this going to be something that's used in the long run? And perhaps having written guidelines would help, because to be honest right now, with the two-pager that was shared by Dr. Valerio earlier in his slide about the structure of the documents and also the video, just by reading and viewing that video, it's not enough for me to self-navigate the James system. I still need that the training from Dr. Valerio. It made me understand the system much faster. But the system is fairly simple to use. So that's just a question of WHO on the plans for James. The last recommendation is on post-approval changes. So this has also been repeated in previous slides, where our recommendation is to consider expanding the scope of review, maybe not to all post-approval changes, but there are specific major post-approval changes such as line extension, new indications, and addition of new manufacturing sites, where the concept of reliance recognition could really add value to speed up access of medicines for these sort of changes to patients. That's all. Thank you very much.
Thank you very much, Sabrina, for the very good suggestions. I'm making note of all of them, so to make sure we don't forget them, we will be discussing them at the end. So I would like now to invite our next presenter, and this is Alice Chi from Apria. Alice will join us also on the floor. And if the colleagues could display the slides, please. Thank you so much, Alice. And the floor is yours whenever you're ready.
Good afternoon. I'm Alice Chi, representing Apria, which comprises of the 6 member associations here from the R&D based industry in ASEAN. Thank you for the opportunity to share some viewpoints from our APRIA members, which were collected recently. This will cover, next slide, please. This will cover APRIA's current perspectives on the AJA, including on these various perspectives. And this will also touch on the challenges and recommendations. And we also have noted requests for updates on the progress related to issues discussed at past engagements, as well as requests for clarifications on other aspects of the AJA procedure. The issues raised by our members here may not all be new, and some are being raised again as issues that still need to be addressed or overcome for participating in the AJA procedure. And also, we want to share some other proposals for consideration. So next slide, please. Let me go straight to the next point. So it is noted that the AJA official timeline is a challenge, as the AJA total timeline may take at least 12 months for approval. And there are national reliance pathways with comparable or faster or more predictable timelines for Singapore, Malaysia, Philippines, Thailand, and Indonesia. So for these countries, there is no clear benefit for industry with regards to the timeline. So our proposal to make the AJA pathway more competitive is to reduce the overall timeline to 120 days for the full AJA route and 60 days for the expedited route. Next slide, please. So the industry is committed to wider access of its medicinal products in more countries. However, there are differences in disease prevalence and healthcare priorities amongst the AMS, and therefore there may not be commercial plans for launch in all 10 AMS. And if the company is not able to select participating ASEAN countries, there could be a waste of regulatory resources and may even lead to a potential withdrawal. The proposal is therefore to allow companies to indicate the list of countries where registration is sought after. And if an NRA is not listed but still wish to participate in the AJA review, the final national registration step would not be carried out in this country, since registration is not applied for. And in addition, the company would not be expecting to submit a specific module 1 for this country. And we think this may help to balance the capacity building goal of the AMS with that of the industry. Next slide, please. On country-specific requirement, it is noted that there are excessive administrative requirements in some AMS, which does not add value to confirming quality, safety, and efficacy of medicines for the patient. So we have proposals for a common harmonized requirement under AJA and removal or at least reduction of country-specific requirements. To minimize the technical requirements and address country-specific requirements under the AJA procedure, it is proposed that a mechanism or guideline should be in place wherein the participating NRAs agree that for products undergoing this procedure, country-specific requirements are limited to label and administrative requirements. And it is also suggested to separate the technical requirements from those that are legal constraints for some of the AMS. Next slide, please. On submission requirements, the core dossier must include the same information for module 2 to 5 as submitted to reference NRA or WHO. And the term same information is open to interpretation, and we would like to propose to accept differences in the CMC dossier with reference country, in particular for minor differences. And documents that are not required for the AMS can be omitted. Next slide, please. We have noted these challenges and questions under dossier submission, i.e. applicant may need to upload the dossier to James and the national platforms. And also the questions such as, at which time point is the applicant being given the access to James? And the proposal is to improve the system, A, to streamline the system so that the applicant is only required to upload one set of dossier and not be required to submit the dossier into the local platforms except for the module 1 after uploading into James. And B, to have clear instruction on how the applicant can manage the submission via the James platform. We note that it may be a big challenge to streamline the system, as James is not meant to serve as a database for the AMS, and it may not be possible to link James with the national registration platforms due to the vast differences with the, of each platform. And also the final registration of the product and the post-approval changes are managed by individual AMS, so there is a need to maintain the registered information for the product in the national platform. So this may remain a big challenge until we find a good solution for it. So perhaps for now, as recommended earlier, the module 2 to module 5 documents should only be uploaded to the individual NRA's registration system after the AJA review has been completed. Next, please. We note from the industry's feedback that a better understanding of the ASEAN JA procedure and the James platform is still needed. We recognize that the workshop organized by WHO to provide training and sharing of best practices has been effective to improve NRA as well as the industry's understanding of the AJA procedure. These activities and engagements should continue. And in addition, there's also a need to expand further on the FAQs. So this platform for open two-way communication has helped tremendously to address many hurdles faced by the industry, as we see from the past engagement as well as today's engagement. These next two slides are on a few other points of concern that have been raised in the past, but which still remains an issue from this current round of feedback that we received. We have listed these points where the feedback given in the past are shown on the right-hand side, and we would like to seek updates on the progress and developments of these situations since the past engagements where these responses were shared. And due to the time constraint, I will not go through all the details. Just to sum up that the updates that are requested are on the approval timeline, how JAC or WHO will ensure that the overall approval timeline would not deviate too much from the proposed timeline for AJA, and on the AJA assessment process and timeline that we need to address that some AMS took a much longer time and seem to have defaulted to the individual NRA standard assessment. Next, please. Okay. There is also, as mentioned earlier, a request for updates to follow up on the post-approval lifecycle management and also on the local NRA readiness to support the JA procedure for smooth and clear submission, including pre-submission engagement. So we are hopeful that further progress has since been achieved and would appreciate to get updates on this. So next, please. As Okay, as mentioned earlier, we have also received requests for clarifications on other aspects of the AGA procedure. And some of these actually were raised earlier in the Q&A. So we can go quickly through this. First, on the priority list, we have this feedback that a sponsor is assessing a product containing new anti-infective substances for AGA, which has 2 API. And generally, both API has been approved, either as a mono product or a combination product. So the question is, does this product still fall under the priority list and hence can proceed with initiation of AGA via the responsive route application? And then on the timeline for queries, there is a question on the estimated timeline for completion. If a second round of query is needed, does the timeline remain the same? So, or would it take an additional 40 days? Then on product eligibility criteria, it's noted that products should be manufactured in a PICS GMP compliance site. And the question here is whether the product is still eligible for AGA if the drug substance sites are in non-PICS countries, example, China or India. Next. So on submission requirements, we had comments to establish when is the earliest we can submit for AGA candidate selection. Does the reference agency approval need to be in place before we proceed to submit the expression of interest, since the form requires details of the reference approval? And the recommendation here is to allow the AGA expression of interest to be submitted in parallel with the reference country review. Then on dossier submission, it is noted there is no DMF submission experience for AGA so far. And I think we had a question earlier during Q&A. Here we also have questions such as, should the applicant file the DMF to the respective NRAs as per usual procedure, or this can be discussed within the group assigned for evaluation? And how are queries being managed, since it will be sent directly to the NRA? And also, does the manufacturer or supplier respond directly and separately to each NRA? And here the recommendation is to include the topic on drug master file, the submission and the correspondence into the AGA guidelines. Next please. So clarification is requested on the requirements for the full JA and the expedited JA routes. It was noted in the past workshop that the full JA procedure requires prior approval by at least one reference NRA and the expedited procedure by at least 2 NRAs. However, in the guideline, this is not very clear, is not explicitly mentioned in the guideline. So we would like to request this to be made clearer, either in the guidelines or perhaps in the FAQ. And then there are also questions on the SRA and reference country, which I think was somewhat also addressed earlier in the Q&A. If the reference NRA approval was granted as part of a work sharing or collaboration review procedure, example, ACCESS or ORBIS, can this SRA still be selected? And also, if the reference NRA approval was based on reliance to another SRA assessment, can it still be selected as a reference country for the AGA? So it would be helpful if we can get clarifications or confirmations on this request or questions so that we can have a common understanding on the AGA guidelines. Next, please. So in summary, we have shared some of APRIA's current perspectives on the AGA, covering the challenges and recommendations, which we hope can be addressed in further development and improvement of the AJA procedure. We would also like to seek updates on the progress and developments of the proposed actions shared in past engagements. And lastly, we would like to get some clarifications on the other details of the AJA procedures, which we believe can be further supported by more training, extended FAQs, and also written instructions for the James system. Okay, next, please. Okay. I will end here, and thank you again for allowing us to share with you on the issues and challenges that our APRA members still face on the AJA procedure. And as the AJA procedure will certainly be of benefit to the industry for obtaining earlier approval from multiple ASEAN countries, we hope our proposals may help to make the AJA procedure a preferred pathway for us in ASEAN. Thank you.
Thank you very much, Alice, for the very important remarks and suggestions. I think there are very interesting suggestions in your presentation that we are taking note. So I would like now to invite the colleagues from APAC, and there are two colleagues now making the following presentation. This is Stephanie Chen Hui Wen and Richard Pinos. Thank you both very much for accepting to make a presentation today. Please, the floor is yours.
All right. So, hi everyone. I'm Stephanie from MSD Global Regulatory Policy. So I want to thank WHO and all you ASEAN regulators for the opportunity to speak about APAC regulatory agilities and the revised ASEAN Joint Assessment Paper. So I'll be co-presenting this with Ricky, who's from APAC, and one of the co-authors of the APAC Regulatory Agilities paper. And thereafter, I will continue with the revised AJA paper sharing. So I will pass it to him first.
Good afternoon, everyone. My name is Ricky, and I am from PHAP, a member association of APAC. We are excited to be here today for this important discussion, as the reliance mechanisms being discussed are important topics to APAC. Thank you to the WHO team for having us today. So allow me to just briefly introduce our association. Next slide, please. So APAC is composed of 11 R&D-based, or 13 R&D pharmaceutical associations located in 11 economies, covering the ASEAN region, as well as China, Hong Kong, India, Japan, South Korea, and Taiwan. The mission of APAC is to expedite the launch of innovative medicines in the region through the framework of access to innovative medicines. Reliance mechanisms has been a core topic under the regulatory approval system in this framework. Next slide, please. Next slide. Today, I am here to share with you the highlights of a paper we published on regulatory agilities within our respective economies. Next slide. In the second half of 2020, APAC recognized the challenges posed by the COVID-19 pandemic. To ensure continuity of supply of medicines and treatment to patients, the member associations of APAC collectively communicated our support to work in partnership and consider ways of workings with our respective NRAs. APAC promotes regulatory agility of 4 important best practices: the use of reliance, digital platform, acceptance of electronic documents, and process integration. The individual members of APAC then proceeded to work with the respective NRAs towards implementing these recommendations. To determine the progress of these recommendations, APAC then decided to measure the status of regulatory landscape through a survey using direct responses from our NRAs and from the respective industry associations. Next slide. So this is a colorful table of our results that we have collected. I will not dive into each of the results, but I'd like to highlight item 1B on reliance. In particular, the use of reliance pathway within each of the member economies. As you can see, at the time of the study, Q4 2021, most of these economies are already implementing reliance, which confirms what was earlier shared to us by Dr. Ramdi. Okay. Philippines, just a few months after the data collection, also instituted its reliance pathway, covering also post-approval changes. So as we move forward, since the data collection, NRAs continue to explore expanding the use of reliance, and more details can be found in our paper. Next slide, please. So following the publishing of the paper in 2022, APAC continues to work with regulators to sustain our regulatory agilities in the new normal. While we monitor this progress, the association agreed to feature regional reliance as our next step, citing best practices and good models of regional reliance programs, as well as the AJA procedure. APAC is committed to supporting the implementation of regional reliance in line with our stated mission earlier. So next slide. So given this brief background on our paper and our association, we provide our insights on how we can evolve the AJA or the ASEAN Joint Assessment Procedure. As shared earlier, most ASEAN regulators have already implemented their own reliance schemes. Reliance as an alternative registration procedure has been accepted and practiced, or as Dr. Samuel earlier used, implanted. This implanted by individual regulators that have cut down timelines by more than 50%, with some approvals going as fast as 60 days. The confidence and competence of using reliance has already been built in our regulators through the years, both through their own individual mechanisms as well as the AJA procedures that was already reported earlier. We believe that it is time that we chart a clearer path moving forward to continue ASEAN's progress on reliance and maximize its stated benefits. The body may perhaps, in another session, consider crafting an ASEAN reliance roadmap on what can be the next step that will support ASEAN's goal of integration, as well as JACG's vision of medicines for all of ASEAN. Milestones may be set in specified timelines wherein we can start moving towards a full reliance for the region, something that our leaders here today may consider. In parallel, improvements in the existing AJA procedure may be sought, as recommended by the earlier presenters, so that this procedure may offer the same or even more benefits than the existing individual NRA reliance mechanisms. APAC is closely working with our FPIA colleagues on specific operational recommendations, and may I call on Stephanie to share this with you. Stephanie.
Ricky, so I'll take it from here, and I would like to share with you some recommendations to the ASEAN. Oh, next slide, please. Yeah. Some recommendations to the ASEAN Joint Assessment Procedure. Next slide. For your consideration. So I'm here today representing the FPIA ASEAN Regulatory Network as well as APEC. Next slide, please. Yeah, so firstly, we want to thank WHO and our ASEAN regulators for your comments on the FPIA ASEAN AJA position paper around end of last year, and for the opportunity to continue our discussion today. So our objective is to collectively review some of these WHO comments provided, which informs our recommendations for the draft revised ASEAN Joint Assessment Position Paper, version 2023. And I'll present these considerations for your perusal in the next few slides. So these recommended new changes to the AJA procedure will include streamlining operating process, participating NRAs, optimizing timelines, as well as aligning dataset requirements to international standards. Next slide, please. Yep. So first up on streamlining operating process. So we propose for a joint Module 1 in James. where the company should upload country-specific requirements from all AMS into the AJA Joint Module 1 in James, consolidating all local specific requirements in one place. And each ASEAN HA will only review documents that are relevant for them. And ideally, local specific requirements should be minimized or done away with for this step to be fast. The absence of country-specific requirements will position AJA favorably in comparison with ASEAN member states' reliance pathways, which does come with country-specific requirements. And hence, we recommend that it shouldn't be necessary to submit the administrative part of the dossier to each participating NRA, but making full use of WHO James by having a joint M1 section. And for my next point, in the current guidelines, it states that the technical part of the dossier should be uploaded into the James platform. However, companies encounter the situation of having to submit dossier to respective participating ASEAN member states, despite previous uploads to WHO James. And therefore, we propose that the company should upload only one core dossier on James without having to submit another copy into individual ASEAN member state system, which is duplicative. One more click, please. Yeah, so for each completed AJA filing, we do recommend an effectiveness review by ASEAN NRAs to assess the AJA pathway's impact. Next slide, please. So now on participating NRAs. Currently, notes announcing priority therapeutic areas and indications will be posted on ASEAN NRA's website, inviting expressions of interest from applicants for the submission of applications for JA candidate product selection. And this procedure doesn't allow applicants to select the countries they wish to apply for product registration in. So to make it easier for companies to participate, the AJA should be an official codified filing pathway in each ASEAN member state, with clear procedures available on each local AMS Health Authority website. This is to provide predictability to companies in consideration of a certain ASEAN member state in an AJA filing. And in this way, company is given the autonomy to decide which ASEAN markets they wish to file an AJA in. And it's similar to the EU decentralized procedure, where applicants can decide which EU countries should participate. And next up, my next point, the NRAs should not be added or changed midway once an AJA application starts, because this is to reduce delays. Previous slide. Yeah, so while the change of NRAs during an ongoing AJA is not stated in current guidelines, companies have encountered this in practice. Next slide, please. On optimizing timelines. So currently a full AJA procedure should be completed within 150 days if a JA meeting is required, and 135 calendar days if a JA meeting is unnecessary. That's from the recent guideline. And from the availability of the application dossier to the finalization of the JA report. And completion may be achieved in a significantly shorter time if the expedited JA procedure is selected. However, for the AJA pathway to be considered over ASEAN member states' reliance pathways, the AJA review timelines should be comparable with any ASEAN member states' reliance procedure. So industry is supportive of working with WHO and AJA stakeholders towards optimized timelines of 30 calendar days for the expedited AJA and 60 calendar days for the full AJA from core dossier submission to the joint regulatory recommendation and issuance of reliance report. And Dr. Samvel earlier mentioned that time is of the essence in broader access of medicines across ASEAN. And moreover, our host country has set a very high bar of 30 and 45 days for their reliance pathways. And next up, current candidate product selection process is up to 135 days. And we are proposing for candidate product selection, this 135 days to be amended. And as mentioned earlier, for AJA to be an official national pathway among ASEAN member states, where sponsor has the autonomy to choose this pathway to file a product of choice in 2 or more ASEAN member states. Next slide, please. One more click. All right, yeah, so this diagram shows the proposed timeline for both the expedited and full AJA from the core dossier submission. And one more click, please. One more. Yeah, to the joint regulatory recommendation and reliance report issuance. Yeah, just a quick note, the 30 and 60 days excludes the review of the joint M1, local specific requirements, and also excludes the time taken from the AJA regulatory recommendation to national regulatory approval, national decision making rather. Next slide, please. And also sharing with you some of our previous recommendations featured in the 2002 WHO AJA position paper, which we would like WHO's thoughts on. It also echoes some of the points mentioned by Sabrina earlier. We are proposing that additional stability data on top of Zone 4 should not be requested for the same shelf life with reference agency, because currently, to claim the same shelf life as approved by the reference agency, additional real-time stability data is often required by ASEAN member states. And also, there should be an acceptance of multiple manufacturing sites in one license instead of having a one site, one license requirement as seen in some AMS. And lastly, to reduce duplication, an additional certificate of pharmaceutical product should not be requested in addition to the reference agency's assessment report, as reliance on a reference agency's assessment report is already done in an AJA review, and therefore the usage of CPP is duplicative, as it is another reliance tool that similarly attests to the assessment of the reference authority. And with that, I shall conclude my part, and I'll pass it to Ricky for the summarization of our session. Thank you.
Okay, just one more slide. Next slide, please. Okay, just so in summary, we just want to express APAC support in regional reliance initiatives, and that again, reliance is already implanted in our AMS. We believe that the JACG and the AMS can take the AJA to the next level of reliance by chartering a clear roadmap moving forward and realize its vision to ensure access for all ASEAN citizens. Parallel to this, we provided specific recommendations on the AJA procedure. Allow us to close our presentation by saying that we from the industry hear the call towards stronger reliance and greater collaboration within the region, and are ready to support you for greater reliance in ASEAN. Thank you.
Thank you so much, Stephanie and Richard, for the very good presentation and very objective suggestions. So once again, I just wanted to emphasize we are just on time, so we are going to break for a coffee break. But before that, I just wanted to summarize that we heard from two companies on their specific experience with the ASEAN joint assessment. So two companies that actually have experience to go through the whole procedure, and so they shared their lessons learned, the benefits of the procedure, but also provided some suggestions on ways to improve it. And then we also learned from two industry associations, so APRIA and APAC, on their expectations of what the procedure should look like, and also recommendations for the ASEAN joint assessment procedure to be more widely used in the region to improve access to quality products by ASEAN population. So thank you so much to very good suggestions for very good presentations. We have a Q&A session after the tea break. This will be then managed by Dr. Samuel Zatian, and we will also summarize some of the proposals and recommendations provided during this session. Thank you so much, and please, the tea break is now open. And the colleagues that are online, let's aim to be back at 3:30 Manila time. Thank you.
mentioned earlier today. So it is in your own interest to be efficient with this last session. Otherwise, you will not have time to see Manila. I know some of you are traveling tonight, including myself. So let's try to do our best to have this session as short and as efficient as possible. So we have been listening to contributions from industry associations with numerous suggestions. And also we had some questions coming online on the platform. So we will have now a very short round of questions and answers, and then which will be then followed by some sort of finalization of the proposal based on these discussions and your recommendations. So Mariana, will you help me with these questions, please?
So thank you so much, Samuel. So on the chat, we don't have, we just have one question, which is actually to Malaysia and PRA. But obviously we will open the floor to questions also in the room. So if you have any question, feel free to also raise your hand in the room. And I wanted to also ask afterwards, Alice, if you could repeat just the two last questions you had in your slide, if you want to elaborate more on those, so the countries and the Secretariat can try to answer those questions. If you can remind us of those two last questions that I made note. So the question we have at the moment in the chat is for NPRA. And it reads as, NPRA noted that for the ASEAN Joint Assessment local requirements, there is a project to streamline and reduce the local requirements. For this, is there a consultation with the industry? I will invite my MPRA colleague, the assessor. Madam Rosliza, you want to take that?
Okay. Thank you, Dr. Azwana. Rusliza here from MPRA. I think, thank you very much for the question. I think if we wanted to consider some flexibility in terms of the local requirements, I think we need some consultation also with other assessor internally before we can actually engage with the industry. I think that's our take on that particular matter. Thank you very much.
But yeah, anyhow, we are open for dialogue. So I think the pharma community already that we have an open door policy. We have regular dialogues with pharma. Yeah. Yes. We open to any questions or consultation. So even we also have regular dialogues pharma itself. So there's no issue. At times, you know, there are local flexibilities that we, it's subject to discussion and consultation locally. Thank you so much. And I also would like to emphasize that from what I'm aware, for example, your facilitated registration pathways guideline is being consulted externally with external stakeholders. So there is always opportunity for companies to provide feedback on your procedures, requirements. That is true, Dr. Mariana. So it's currently under updating, under review, and now we have sent it our pharma copy and the association, the relevant association, for their feedback, because to improve guidelines, change things like regulations. This is what we do some form of consultation with the stakeholders and the industry before anything is agreed upon, especially on guidelines. So there is always room for feedback or suggestions from pharma that there is. Thank you very much, colleagues from NPRA. On the chat, so we don't have any other question. I would like now to open the floor to the colleagues in the room. So any colleague from the countries or the industry, if you would like to take this opportunity to make your question. Or maybe Alice, if you could just remind us of the two questions you had in your slides, the two last questions, so the colleagues could try to address them.
Yeah, I think the last was on the SRA and reference, right? One you are referring to. The first question is, if reference NRA approval was granted as part of work sharing or collaboration review procedure, assess or audit, and this SRA still be selected?
Can you repeat the final part? Can if the SRA is part of the procedure, can the SRA be selected? Can you just repeat the final part, please? If we understood correctly.
Yeah, there are actually questions. The first question is, if reference NRA approval was granted as part of a work sharing or collaboration review procedure, like assess or audit, can this SRA still be selected? And the second question is, if reference NRA approval was based on reliance to another SRA assessment, can it still be selected as a reference country for AJA?
Okay, so I will try to answer the second one. Maybe the other ones I will open the floor to other colleagues to also comment on the first one. So on the second one, if the reference authority relied on an SRA or another reference authority to take their decision, then we cannot consider that reference the second reference NRA, because there won't be a full assessment report available. So we need always to rely on the first SRA that conducted the full assessment. So that's the assessment report that can be utilized, and that's the SRA or the reference authority that can be utilized for the procedure. Would you like Dr. Azwana to also comment?
I think the first question was, we discussed the first question, I think earlier. It's regarding the reports that come from joint work sharing and joint assessment of OBIs or access, for example. The issue would be getting the report itself. Probably with USFDA, probably it's not easy to get the report. But just now, Dr. Felicity mentioned that if it's with access, Dr. Felicity asking the consortium itself, access itself, whether this is possible or otherwise. Because yeah, if we can get access, I mean, we are allowed to get access to the report, I don't think a problem. I mean, that's what I got.
Yeah, so I think there's two parts. One is you need the full report. That might be possible if all of the agencies who participated in the joint review give permission. The second part is the support that's required from the SRA during the joint assessment. So from our perspective, we could only provide support for scientific areas we evaluated ourselves. We wouldn't want to speak on behalf of another agent. So if TGA had done Module 3, we can help you with Module 3, the joint assessment. We don't want to get into the space of helping with Module 5, for example, if we didn't do the full assessment ourselves. So that's also why I said it's sort of case by case. And so industry could make a suggestion, but it would need to be considered based on the situation, the scenario there.
Thank you very much,
Dr. Azwan. Yes, absolutely. I was going even to mention that there is this factor of having an assessment report available to be shared first, as Felicity mentioned very well. A second item, which is you need to also consider what are those authorities involved in the procedure, because there may be some that are not considered SRAs, and therefore they are not considered to be a reference authority as part of ASEAN Joint Assessment procedure. So you need to consider what are those authorities that were part of this joint assessment or work sharing arrangement. And thirdly, indeed, the part of scientific support, as TGA mentioned, the reference authority will only be able to support on that specific part that conducted the assessment. But just to also raise again what Dr. Samuel mentioned before, if this is to be considered in the future, I think more an expansion on the procedure as we have it at the moment would need to be done. So we would need to consult the countries, and the procedure would need to be adapted to be able to accommodate this. So the doors are not closed, of course, depending on the case by case, I would say. But for the time being, we keep it in mind for future revisions of the procedure. Thank you so much for the questions, Alice. Is there any other question from the floor? From the room and from those attending online? You can also raise your hand and unmute yourself. I see maybe another question here. So the question says, how would WHO or ASEAN authorities distinguish ASEAN Joint Assessment from WHO SRA CRP, which is also increasingly being adopted on top of some available national reliance pathways? So there are a few differences between these two procedures, and it depends on the goals and strategies of the company. So if the goal of the company is to make a submission to multiple ASEAN countries, then the ASEAN Joint Assessment is the best route, as it allows these countries to jointly participate in an assessment, jointly assess and register then the product. We need to consider that the ASEAN Joint Assessment has this component of capacity building as well. We also need to consider that WHO SRA-CRP does not cover all ASEAN countries. So for you to, as a company, to utilize CRP, indeed, you only have for CRP, it's individual applications to individual countries. But at the moment, from the ASEAN area, just a few countries participate. And these are, for SRA-CRP, is Malaysia, Thailand, Laos PDR, and I think that's it. I'm not wrong. So just for consideration. So it depends on the strategy of the company and to which countries intends to make the submissions, if it's to one or two, or if it's to three or more. So in those cases, if it's to three or more ASEAN countries, it would be then eligible to be submitted the ASEAN Joint Assessment, and therefore this maybe would be a preferable pathway, but it will depend obviously on the company strategy. Yeah, Kamal, please.
Also, to mention something that we have discussed yesterday, colleagues, this is about smaller countries in the region, which are sometimes not attractive for the industry to submit their applications. And this procedure would also potentially allow the establishment of some joint or pool procurement mechanism. This is something that we are absolutely going to propose at the next PPWG meeting to consider, because this would perhaps help address the challenge of smaller countries in the region, which are desperate because of their smaller markets, and they need some products, but the industry cannot be blamed for not being interested in submitting in the country where they do not see any commercial interest for them. But joint procurement could perhaps help address this issue, and in this context, this procedure is more attractive compared to CRP in that specific case.
Thank you so much,
Samuel. So there is another question on the chat, and the question is for ASEAN joint assessment procedure. One observation was that agencies may lack training on how to use the ASEAN joint assessment procedure or how to use the WHO system. Is there a consideration for a training academy on ASEAN joint assessment, similar to the recent ICH training library for their guidances? So I'm not fully aware of the ICH training library, but I can assure you that similar to CRP, we keep providing support to these ASEAN countries, and the fact that we have more applications, so countries become also more aware about the procedure and how to apply it in-house. So there is indeed a continuous learning and support provided to all countries, and also from those countries more mature to those NRAs from smaller countries. Would you like to add anything else, Dr. Aswana? There is another question on the chat. How does ASEAN joint assessment will manage different product classification of the same product between ASEAN NRA and SRA? Example, generic versus NCE, pharmaceuticals versus biosimilars. Maybe the colleague could raise the hand and then mute themselves. So just so we understand a little bit more about the question. We don't make, at the moment, the procedure does not make any difference on the product classification. So, and between the two procedures, ASEAN and joint assessment and SRA CRP, there is also no and there is no difference in terms of on the product classification for you as an applicant to apply. So I'm not sure what was the question here, but there shouldn't be any difference on this classification. Yep, Felicity, please.
I think if I understand the question, if, for example, in Australia, if the active pharmaceutical ingredient hasn't been included on the register, the application needs to be an NCE under our framework, irrespective of whether it's an originator product or an innovator product. So I think, if I understand the question correctly, the person asking it is anticipating that those sorts of definition differences could exist between the ASEAN member states within themselves or with the SRA, and that affects the data requirements. Because obviously the dossier for a new generic medicine has less data than an NCE. And then different people have different biosimilar requirements. In Australia, they're not treated in a similar way to new generic medicines. They go through the NCE pathway with additional requirements. So some of those differences could lead to different data requirements, which means it's not as good a candidate for a joint assessment, if I understand the question correctly. I don't know what the answer is. That's just my take on the question.
Thank you so much, Felicity. Yeah, maybe you're right. That was the intention. So, but in those cases, I think here we have a little bit of a different situation. So if a company comes in for a product submission, it's for you to conduct this full assessment, right? So obviously you have this additional and this difference in terms of technical requirements. When it comes to the ASEAN joint assessment, so the requirements, they are the ICH CTD product dossier requirements in terms of technical requirements. There may be some national specific requirements, but the idea is to avoid the differences in terms of national technical requirements. So to align it to what is requested as part of the normal full product dossier based on ICH CTD format or ASEAN format. And countries are expected to apply reliance. So the need for these extra national requirements may be also limited in those cases because countries will have access to the assessment reports either from TGA or from other SRAs. But I would maybe ask the colleagues from countries. Maybe they may have different perceptions on that. I think this will depend a little bit also on the country's perspectives. But the procedure as it is at the moment does not foresee any difference as it is written at the moment. Is there any country that would like to provide additional? Well, would you like to add something? While countries are still discussing between themselves, there is another question, and here is there possibility to submit OTC or generic products under ASEAN joint assessment? And I think the answer is yes. But I'm looking at the chair and co-chair. But yes, so as part of the procedure as it is at the moment, it is possible. And there is no other question in the chat. Do we have any other question from the floor, from the room? If not, maybe I will hand over it to you, Samuel. Thank you so much.
Thank you very much, Mariana, for facilitating this questions and answers part session. So we see that it's really challenging because there are sometimes some very minor issues or specifics of the processes which otherwise we would not be even able to think about. But through this type of interactions with you, we receive such questions, and it helps us to also to tune our thinking and trying to find some solutions and, to improve the procedure and to try to address all of your expectations. So I think this is another justification for this type of interactions between regulators and the industry. So then I think this would allow us now to move to the last part of our session, and this is to discuss the suggestions which were made by the regulators in the countries to the industry and vice versa. Those suggestions from industry to regulators and to WHO in order to improve the ASEAN joint assessment procedure. So with regards to the suggestions from countries to industry, there are three main suggestions. And the first one is to appeal for applicants to submit more applications through ASEAN joint assessment pathway. This is something that we are all desperately looking for, because the meaning of this procedure will be only there if we have enough products going through this procedure. Otherwise, the impact will be very limited. So, and we mentioned yesterday, we were joking that maybe in the coming months, we will have not 2 or 3, but dozens of products per session to be discussed, as it is happening in some other instances in other regions. Of course, we are learning by doing. So we are not desperate about the relatively small number of applications. Hopefully, it will be increasing. And this increase in the number of applications would help to have more products reviewed under the joint assessment procedure, will help to improve capacities and experience of assessors, also in applying reliance and to work efficiently in ASEAN member states. This is one of the objectives of this whole process. So it's not only about improving access, but also to improve the regulatory capacity, which we already can see. Also, it provides an opportunity for ASEAN member states to further improve the procedures and the timelines. And this is absolutely also consistent with the expectations of the industry. Timelines is what they are looking for. Also, advantage or benefit to applicants include concurrent submissions and registration in multiple countries and consolidated questions during the assessment. This is again very much in line with the question that was raised just in the beginning of the session about pros and cons of this procedure versus CRP. Also to propagate information regarding ASEAN joint assessment and the benefits which this procedure can offer. Absolutely good suggestion. And to consider ASEAN joint assessment as means to support regulatory system strengthening of national regulatory authorities in order to improve regulatory efficiency. So these are all part of the first suggestion about the number of applications. The second is for applicants to consider registering all products assessed under the joint assessment in all ASEAN member states, particularly ASEAN member states participating in the joint assessment to ensure equitable access to these medicines across the region. So very valid point and very noble expectation. When submitting, and the last one is when submitting an application to an SRA, for example, PGA, applicants can indicate to the SRA their interest to submit the application to ASEAN joint assessment. And there is a possibility of early involvement of an ASEAN member states in the assessment of the product, which can expedite the ASEAN joint assessment process later. This is not new, by the way. This is already happening in European context when we are collaborating with European Medicines Agency. Quite often they come back to us asking to identify countries which would be potentially interested in one or another specific product assessment. And we are helping them even to identify experts from the potential target countries that could join the assessment process and bring their expertise, which is sometimes very precious because not always, SRAs are aware of all the specific needs in your recipient countries. And so your experience could be sometimes very precious for SRAs also to help improve their own processes. So this is also, I agree, it's a very great suggestion. So now going to the suggestions from industry to improve the ASEAN joint assessment procedure, and we have here all these suggestions, but Mariana has kindly helped me to collate them together and to consolidate. And the first suggestion is on harmonization of national requirements with ICH and WHO requirements. And this is also, again, a very important point because we quite often we say that regulatory science is based on science, not perceptions. And we have to, as much as possible, pursue this objective because it will help to reduce requirements such as CPP, which is very valid point, additional sample testing prior registration. We are always advocating for minimizing this process in our member states regulatory authority. Different licenses to multiple sites, additional stability testing data on top of zone 4. Another suggestion was to develop common national requirements list and limit the national requirements to administrative and label requirements. So this is also something which we have discussed yesterday with NRAs, and apparently there is a need of also proposing some sort of a process for harmonization of national requirements, not only the technical part of the dossier, but also the national requirements, because as of today, they are so divergent and different, which makes the process of ASEAN joint assessment really questionable in this case. Another suggestion was to include the drug master file into ASEAN joint assessment procedure, not as national requirement. Also to avoid the application of requirements such as submission of full dossier twice in a joint assessment information management system and national platforms. Also, we discussed it yesterday with our national regulatory authorities. We understand that sometimes countries have some legal restrictions which require that they absolutely need to receive application from a legal representative in the country, handing them over the application. But because again, now applications are, you are only receiving a couple of pages of the dossier with the signatures. Most of the dossier is still coming electronically. So again, I also see a lot of opportunity now to use the benefits of joint assessment information management system to avoid duplicative submissions. Another suggestion was on to have more assessment information management system, improvement of the system to allow applicants to manage and handle applications in the platform. So many suggestions about the electronic system, James. Also James to allow monitoring timelines and develop alert systems when timelines are not met. Very, very critical point to help monitor the process and to have alerts when timelines are not met. Because again, as we mentioned, industries is looking for timelines. This is very critical. Alignment of James with the national platforms to avoid duplication. Of course, also understanding the existing systems in the countries. It's not easy to get rid of them and to move to a new system, which is very costly exercise, but as much as possible, this alignment should be encouraged. Define better the day zero, the start of the procedure. This has been also mentioned many times during the discussion. Better alignment, better fulfillment of timelines of the ASEAN procedure by countries. Timelines are not followed by countries in the ASEAN joint assessment as per the procedure established. So what can I say? This is again a valid criticism that of course need to be taken into consideration. Also, following the procedure, better fulfillment of timelines for registration. Again, we see sometimes that the joint assessment could be done efficiently, report generated, but if the report is sitting in the countries and not utilized to support their national regulatory decision, then it also dramatically decreases the value of the whole process. Another suggestion is to NRAs to be more aware about the new revisions in the procedure and the new steps and requirements. This is done through daily interactions of WHO team with NRAs. We are having the regular meetings with them and trying to make sure that there is no discrepancy between the countries in terms of understanding the procedure and implementing the procedure. List of questions to be submitted to the company and not to the local affiliates to ensure harmonization. Again, I understand that here, country by country, we have different practice and different tradition, and as much as possible, this needs to be also harmonized, which would help to shorten the timelines. Expansion of the procedure to post-approval changes, particularly line extension. We have discussed this, and we have the same process now in the context of collaborative registration procedure. And you all, colleagues in NRAs, you know how burdensome is the process of maintaining variations more than the initial authorization. So, of course, the value of this whole joint assessment procedure will be very limited if it is only limited to the initial authorization. So, as much as possible, we need to also consider variations. To make ASEAN joint assessment pathway more competitive, reduce the timelines, 100/60 days or 60/30 days. Full joint assessment / expedited procedure. So we are only supportive to this suggestion. And this is something which also we discussed yesterday with NRAs and SRAs, those who are participating in this meeting. And we understand that this is something that industries are absolutely looking for. So we would do our best, and we'll continue discussions to see if there is a potential to further decrease, shorten the timelines, and see how this could be implemented. Allow companies to indicate the list of countries of preference for ASEAN joint assessment submission. I think we have already this in place. It's not something that is new. When the process starts, then applicants indicate where they would like to first submit their products. Of course, our expectation is that as much as possible, it should be submitted in all ASEAN countries, but also understanding that preferences could be different from one applicant to another. And what we mentioned earlier also about the smaller countries' needs, we need to find a way of addressing smaller countries' needs. So this is absolutely important for us also at WHO and ASEAN as a group. Yeah. Also, there was a minor suggestion on NRAs to accept CMC minor differences in the dossier. Also, this is something that we can't decide on behalf of NRAs, but we are for wider and deeper harmonization of the requirements, which will only help to make the process more streamlined and smooth. Procedure to allow expression of interest to be submitted in parallel with SRA review. Also a very valid point. If it is at all technically possible, this would be a great improvement in terms of shortening timelines. And the last suggestion from the industry was to have an annual WHO workshop to continue, as it allows industry and countries to learn, improve practices, and share experience. I mentioned yesterday and will repeat today, it will only depend on the progress that we are able to demonstrate, because WHO is also dependent on the support coming from our donors and our member states for the funding, and we can only defend this project and continue this project if we are able to demonstrate tangible results and practical outcomes. So better we work, more we will get also from our member states, donors, and WHO itself. But otherwise, technically, of course, all countries in ASEAN are members of WHO, and in any instances, we will be continuing our support to these countries, whether in the context of this project or outside. But of course, we would prefer that this project continues, because we have already invested so much, and we would like to see some fruits. And so we have a dedicated team behind this secretariat, and Mariana and other colleagues. So I hope that we will be able to continue and collaborate with the Joint Assessment Coordination Group, with chair and co-chair, and relying on your support and support from our honorable also partners, SRAs in this region, and industry. Ultimately, we will be able to achieve the goals that we are putting in front of us. So this was more or less what was the suggestions from both parts, from NRAs and from industries. And I just would like to ask if we have missed anything, you can still raise it. If not, we can take this into consideration in the preparation of the report for this meeting, and and making these recommendations actionable and implementable as much as we can. So please, colleagues, if you have any addition, any suggestions, you still have time to raise it. If not, then I would maybe ask my co-chair and chair of Joint Assessment Coordination Group, Madame Azuana, to also share her thoughts on this before we conclude.
Thank you, Dr. Samuel, and thank you, Dr. Mariana, for a nice summarizing and the recommendations on both parties there. I think it has been nicely concluded, and we in JAC, as a chair of JAC, have taken notes and we have discussed some of these recommendations, because what has been raised by applicants today, some of them are also concerns of the AMS as well. So things like timeline, streamlining the procedures, we have made some proposals to improve those things because they are also of concern not only for the applicants but for us as well. So be assured that those recommendations will be thought of or will be discussed, and will be hopefully able to propose to JACG to improve further the joint assessment that ASEAN joint assessment that we have. I have a temporary sort of a recommendation for some of the recommendations given to us. I think to improve the timeline, to streamline the procedure, as I've mentioned in my presentation this morning, goes back to experiences. So how to get those experiences? It goes back to, please send your applications in. So with those applications, we'll be able to train our assessors and make the process better and the timeline probably shorter in that process. So really, that's the temporary answer for us to actually, address some of your proposal and some of your concerns the other day. Right. Dr. Samuel, I don't have anything else, but I will take this opportunity to again, on behalf of JACG and PPWG, thanking our colleagues at WHO for their continuous support, particularly in this joint assessment, ASEAN Joint Assessment Initiative. It has been great working with them. They have been really helpful. Particularly for me, this particular project, this particular initiative is really new to me because I've just started in March, but they have been very helpful, and I can see that this initiative will go much further, just like any other consortium or science consortium that we have globally. So I have good feeling about this joint ASEAN joint assessment to be to have at least 25 products in one session, right? Okay, and then I also would like to thank our colleagues from TGA because the products that we have so far, TGA has been kind enough to lend their scientific knowledge to help our assessors in assessing those products, and also PMDA has also come aboard to help us training on reliance as well. So I like to thank everyone, and also I also would like to thank all the AMSs. I know those who are involved. It's not easy because but with your commitments, I'm sure this project will go further. So I thank also the participation, the participants from all the AMSs that has been for. And last but not least, I also thank all our applicants, the industry, because as you can see, it's work in progress, and we need your contribution, we need your help for this to go further. Because as we can see, as we have discussed, the benefits, the advantages, it's for both parties. And at the end of the day, it's about improving access to medicine. And one way or another, we will also be patients ourselves. So access to medicines is really important, not only for the region, but also for ourselves. So I think Dr. Samuel, with that note, I pass back.
Thank you very much, Dr. Azwana. I think I could consider your words, your statements are already kind of a closing remarks in a way from your side, because you did it really very well. You just made one little mistake. You said 25 applications per session. I would just say minimum.
Right, okay.
This is what we have agreed. And under your leadership, I think we will be able to do even more. As a new chair for ASEAN Joint Assessment Coordination Group, this is the expectation that in front of you as a group to lead us and to help us achieve this task.
Yeah, I will get help from them. So,
Yeah.
I'm not too worried. Yeah. Okay.
So with this, I think I have nothing to say more, but just to proceed to the very last part of this meeting, just to join my own closing remarks to what Dr. Azwana just mentioned. Again, I'm always mentioning that as human beings, we have one common thing. We can't live alone. We have to live in groups. We have to collaborate in order to survive. Collaboration is the only way for human society to survive, to maintain, and through this type of interactions, we are improving our ability to survive and to live better lives. And we can see even in this 2-3 days meeting, we have achieved a lot through this in-person interaction. We have heard each other's concerns, ideas, and this was so useful for all of us to understand what is that we are trying to achieve and how we can achieve that faster, better, with less resources, less effort, more efficiently, because ultimately what we do it for patients. And I also want to remind one of our ICTRA meetings, actually in the most recent meeting, which was face-to-face in Ireland in 2018, when the slogan was "Patients are waiting," and one of the participants said, "No, patients are not waiting; they are tired to wait." So we should really avoid the situation when patients are tired, because our role and our mission is to help patients to have access to most needed essential medical products. And this procedure is something that would potentially help us to achieve this goal. So I just again would like to request and call for joint action, for joining our forces and efforts, our brains, our passion to achieve this goal of improving access to essential medical products. Because we ourselves are also patients. Our families are patients. So we are not doing it for strangers somewhere else on a different planet. We are doing it for ourselves, for our families, for our children and grandchildren. So this is something that we should have in front of us. Every time when we are thinking of, oh, this is difficult, this is not possible, everything is possible. This is what we have learned during the pandemic. So let us continue this process with enthusiasm and the passion that we have as regulators. And because from industry side, they are also regulators. So they are just from other side of the process, but they are also concerned equally as we are to have the processes streamlined, faster, efficient. So let us do it together. So with this, I just would like to thank again to all regulators who participated in this meeting. It was an intensive discussion, and we learned a lot from you. I also would like to thank our colleagues from TGA Australia and PMDA Japan for their agreement to come to this meeting and to contribute, because their role is also absolutely critical, and we learned a lot from them, and we hope that their involvement will be continued and even improve this whole procedure. I would also, of course, need to mention our donors, those who have supported this activity for many years, starting from 2016, and the Bill and Melinda Gates Foundation, who has provided us with necessary resources to start this process and to maintain it for so many years, and we hope that this support will be continued. Also, of course, we need to express our gratitude to the organizers of this meeting at the country level, the government of the Philippines that has agreed to host this meeting, and our country office, WHO country office in the Philippines, and Juan Paulo Tonolete, who had to leave, unfortunately, before the end of this meeting, but we will send him a separate note also to the WHO representative in Philippines, but also our regional office in Manila, and my own team in WHO headquarters, and other colleagues in WHO headquarters, those who have contributed to this meeting. I also would like to, of course, thank the organizers here locally. But when I say WHO team, I also not forget, yes, our consultants and temporary advisors, those who were next to us all these difficult years. And also the hotel and those who have provided support to organization of this meeting in such a beautiful place. And I was also touched with their daily requests of doing this security and safety briefings, which is very important. Sometimes we underestimate these things, but it's really important to demonstrate their commitment and care about us. And of course, they worked very hard with Andrea, who is the, I call her femme de réunion. She was the one who has organized all these things, and she requests special thanks for her daily and very hard work, of course, in collaboration with others. And the people who are here in this room helping us with all this audio-visual equipment, interpretation, Zoom platform, and all those things are, of course, without their work, we would not be able to do it. And of course, all people who were behind the electronic platform, joining us remotely and patiently waiting before we go to coffee breaks and lunch while they were deprived from this privilege. I also would like to thank all of them also for their important questions and contributions. So it was absolutely important for all of us. And special thanks to chair and co-chair of ASEAN PPWG for their also support and patronage for this activity. Their support is absolutely important because they are our interface to PPWG. And we hope that PPWG will be taking our suggestions seriously and taking appropriate actions to help us to improve this process. So please remind me, colleagues, if I have forgotten anyone else. FDA Philippines, I mentioned the host country, of course, their role was absolutely indispensable. They have done a so great job in collaboration with ASEAN member states. I do not want to distinguish them specifically from ASEAN because they are ASEAN. But it is true that they made themselves available with a big group to come and participate in person in spite of their busy schedule. So I would like to thank, of course, my colleague Joyce and other colleagues in Philippines FDA for their daily support in organization. And I would like also to expect and express my wish that these meetings will be continued, which was very much also in line with the expectations from the industry and for others. So with this, again, thank you very much, all colleagues, and please enjoy your remaining time in Manila efficiently and with pleasure. And I hope to see you again very soon. And now wish you safe travels back home. Those who will be traveling to different countries and those who will be here in Manila, please enjoy your stay. Thank you very much. So we are expected also to have a group photo. We had already several group photos during these days, but we will have another one now with industry